Professor Estelle Victoria Lambert is an emeritus professor and senior research scholar. Part of the Research Center for Health through Physical Activity, Lifestyle and Sport, and Division of Physiological Sciences in the Department of Human Biology at the Faculty of Health Sciences in the University of Cape Town. She is also an adjunct professor at the School of Health and Medical Sciences in the Faculty of Health, Engineering and Sciences at the University of Southern Queensland in Australia. Professor Lambert is the former director of the UCT accredited Research Center for Health through Physical Activity, Lifestyle and Sports, which she led from its inception in 2018 until 2023. She is a National Research Foundation B1 rated scientist. Her research concerning physical inactivity and obesity includes work on the prevalence, burden of disease, correlates, determinants, and ecological factors associated with these risk factors across the life course, from the intrauterine environment to adolescence to older adults, and most recently involving community, socio-environmental, and behavior change interventions. The focus of her research has been primarily in low and middle income countries, and more recently on the nexus between physical activity insecurity, food insecurity, the environmental and social determinants, and health equity. She has been internationally recognized for her contributions in the fields of physical activity, obesity, and non-communicable diseases in low-middle income countries, resulting in her inclusion as an expert consultant to the World Health Organization on a variety of topics including physical activity and health since 1998. In 2016, she served on a team tasked with developing the Global Action Plan for Physical Activity, specifically incorporating the physical activity agenda into the United Nations Sustainable Development Goals. In 2019, she was selected to be on the World Health Organization Guidelines Development Group to formulate the 2020 Global Recommendations for Physical Activity and Sedentary Behavior. Also in 2019, she was invited to be an expert consultant for the Global Regulatory and Fiscal Capacity Building Program promoting healthy diets and physical activity. She was co-founder and chair of the African Physical Activity Network from 2007 until 2013, and has been the lead or co-lead of the Healthy Active Kids South Africa Report Card Evidence-Based Advocacy Initiative since 2007. She has been in-country co-principal investigator on the NIH-funded Modeling the Epidemiological Transition Study, a 5-country longitudinal cohort documenting relationships between physical activity and obesity in persons of the African diaspora. She is also an in-country co-PI on the NIHR-funded Global Diet and Activity Research Network, in collaboration with the SAMRC Epidemiology Unit at Cambridge University and colleagues from Kenya, Cameroon, Jamaica, Nigeria, and Brazil. During her career, she has supervised or co-supervised 20 PhD students and 11 MSc and/or MPhil students, and is currently co-supervising 3 PhD and 1 MSc students. She is an author or co-author on over 360 peer-reviewed publications with an H index of 70. Emeritus Professor Lambert was an integral part of the SAMRC unit for bioenergetics of exercise research unit under Professor Tim Noakes. This unit then evolved into the SAMRC Research Unit for Exercise Science and Sports Medicine, also under Professor Noakes, which together ran for 25 years, from 1989 to 2014. Furthermore, she worked with the MRC Chronic Diseases of Lifestyle Unit to ensure that physical activity became part of South African adult NCD surveillance in the first SADHS in 2003. During COVID-19, Lambert spearheaded an initiative along with 40 colleagues from 9 African countries, including those from the SAMRC, and together they developed 4 policy briefs for promoting and implementing physical activity in the public sector, for children, for persons living with disability, and in school sports during COVID and beyond. More recently, Professor Lambert has been a collaborator on a project called Food SAMRC, a 3-year project that aims to address malnutrition in all its forms, including undernutrition, micronutrient deficiencies, and healthy diets, and obesity, by assessing its determinants and by exploring interventions at the macro, policy, the meso, community, and the micro, interpersonal level. This project is in conjunction with the SAMRC, UWC School of Public Health, UCT Chronic Disease Initiative in Africa, and the Ludwig Maximilian University in Munich, Germany. Emeritus Professor Lambert continues to be a champion for physical activity and health, environmental and social justice, using citizen science as a tool for both gathering evidence and promoting advocacy.